So coming to the definition of brain death, it is defined as the irreversible loss of all functions of the brain, including the brainstem. Brainstem is very much important in this case. So irreversible loss of the all functions of the brain, including the brainstem, is the definition of brain death. So what are the three essential findings in the brain death patient? The patient must be comatose, absence of all the brainstem reflexes, and the patient is having apnea. That means the patient must in the ventilator. Apnea, that means obviously if the brainstem reflexes will be absent, the patient must have in the apnea, because in the brainstem only the respiratory center is there. If the respiratory center will be stop functioning, the patient will develop complete apnea. So what are the prerequisite, or what are the three things that must be present in the brain death patient? The patient must have coma, the absence of all the brainstem reflexes, and the patient is in apnea. So these are the definition of brain death: irreversible loss of all the function of the brain, including the brainstem. The definition of brain death will already come in exam. What are the preconditions for the brain death testing? Whenever you are going to test a patient of brain death, there are certain preconditions you have to rule out before doing the test. So the patient must be identifiable pathology causing irremediable or irreversible brain damage. This may be intra or extracranial pathology. There must be a pathology which can be either intracranial or extracranial, that is a potential to cause brain death or irreversible damage of the brain. The patient must be apneic, we have already discussed, needing mechanical ventilation. So the patient must be in the mechanical ventilator. This condition must not be secondary to the effect of sedative drugs. The patient may be apnea, or the patient have developed apnea not because of the sedative drugs, nor because of the neuromuscular blockade, the patient is in ventilator, but as the patient brain stem is death, or the brain stem reflex is absent, the patient is now on the mechanical ventilator. So you have to rule out that the patient has not done any sedation, that the patient has not given any neuromuscular blockade, and not because of that the patient is in mechanical ventilator. This may require testing with nerve stimulators to show intact neuromuscular transmission. There should be a intact neuromuscular transmission. Alternatively, demonstration of the tendon reflex can also demonstrate intact transmissions. So we have to go for different testing like deep tendon reflex or superficial reflex to check the integrity of the nerve. The patient must be deeply unconscious. There are different causes of unconsciousness that should be ruled out, like if the patient is very much hypothermic, or hypothermia must be excluded as a cause of unconsciousness, and the patient core temperature should be over 34 degrees Celsius. If the patient is having hypothermic, so the patient may be unconscious because of hypothermia, but before going to the brainstem reflexes testing or the brain death testing, we have to rule out hypothermia, and the core body temperature of the patient must be more than 34 degrees Celsius. There should be no evidence that the patient's state is due to depression drugs. Like if you use different types of depression drugs like propofol or midazolam or dexamate, the patient may be undergo deeply unconscious. So we have to, there should be enough evidence, or the ample of evidence, that the patient will be not in the state of depression drug. It refers to narcotics, hypnotics, tranquilizers, as well as neuromuscular blocking drugs. A careful drug history is required, and the drug levels antagonists may be need to be used. Suppose you are in doubt that the patient is deeply unconscious because of the neuromuscular blocker, you can go for neuromuscular reversals. If you suspect potential reversible circulatory metabolic endocrine disturbance must be excluded as the cause of continuing unconsciousness. There should not be any circulatory, metabolic or endocrine cause to produce unconsciousness. Some of these disturbance may occur as a result of the condition rather than the cause, and these do not preclude the diagnosis of brainstem death. Some of this disturbance may occur as a result of condition rather than the cause, and this should not preclude the diagnosis of the brainstem death. So before going to test the brainstem, or to declare a patient of brain death, or to carry out different test of brain death, we should rule out this type of history: hypothermia, drugs, and potential circulatory, metabolic and endocrine disturbance. This should be ruled out before testing the patient to be brain dead.